Welcome back. You're still watching KUTV Primetime News, and we are back with an interesting conversation on testicular cancer, as I had hinted before the break. Now, according to healthline.com, testicular cancer is a cancer that originates in one or both testicles or testis. Testes are the male reproductive glands located inside the scrotum, which is the pouch on the skin located underneath the penis. Testes are responsible for producing sperm and the hormone testosterone. Testicular cancer can affect anyone who has testes, including transgender and non-binary people. This cancer is rarely talked about, and that means we're here to talk about it. And that's what we're here to do. And I'm joined by Kevin Oduor, a health specialist who is here to shed more light on testicular cancer. Karibu sana, Oduor. Yes. How have you been?
I'm fine.
Let's begin here. Many people have confused between prostate cancer and testicular cancer. What is the difference?
Well, before maybe I mention the difference between testicular cancer and prostate cancer, let me shed a bit more light on what testicular cancer is all about. First of all, testicular cancer, of course, is a disease, or we can say it's a condition that comes as a result of, for example, the cancerous or malignant cells dividing uncontrollably, and that now is what leads now to cancer. Of course, we know what testicles are for, and that will now bring the difference between what testicular cancer is and prostate cancer is. Of course, one of the things that I have to first of all mention is that prostate, first of all, in the name, that makes the difference, but that is not scientific, and that I can't mention as a difference. I can talk about the difference comes in prostate cancer affects those who are above 40 years of age, mostly. And I think I'll give a reason as to why it affects those who are above 40 years. Testicular cancer mostly has been diagnosed in people or young people between 20 to 35. Another difference, of course, would also mention that prostate cancer affects the prostate glands. Of course, prostate glands produces seminal fluid, which helps in transporting sperms. But for testicular cancer, it is in the testicles, and we know that the testicles now are responsible for production of sperms itself, and also what we call the testosterone, which is a hormone, and this hormone helps in regulating production of sperm. The hormone also helps in terms of giving strength. That's why sometimes you'd hear somebody telling you, if you have the balls, then you can face me. That is what they mean.
Okay.
Yeah, so you will be asking yourself, why somebody telling you if you have the balls, it gives strength and also regulates body mass. And there are a lot of things that it does, and that brings the difference. That testicular cancer, you find in the testicles. Prostate cancer, you'll find in the prostate glands.
Yes.
Yeah.
You mentioned something about this cancer being found in younger individuals. Is there a particular reason for this?
Yeah, of course, there's a particular reason for that. Is because at young age, we are producing testosterone, which is the hormone. And according to available research or evidence that is there, is that having or being active during that young age and producing sperms and testosterone, this hormone, increases your risk of getting testicular cancer. That's why it happens, because most of sperm production and also production of testosterone, the hormone itself, happens between 20 to 35, give or take, or even 40.
Okay.
That's why you'll find it's more domiciled in young people. Yeah. That's the only reason.
Okay. Okay. Can we talk about how this cancer is prevalent in the community as compared to many other forms of cancer that affect people? And as you answer that, would you also tell us the burden that this cancer is bringing to the community?
Okay, well, one of the things that I have to also affirm is that these cancers are not really as common as the other type of cancers. But the fact that there are people who present with these cancers mean then they warrant us to try to reduce the burden. So, of course, the burden, if you talk about the statistics, available statistics, points to the fact that there are around 250,000 new cases of let me mention prostate cancer, but only around 40,000 people die annually. That is worldwide or globally. For testicular cancer, around only 10,000 cases annually worldwide, and very few people end up dying. Around 440 people annually globally. So not many people die from this, because one of the things that I have to mention again is that the risk of developing testicular cancer is 1 in, say, 263. Okay. That's according to available evidence, 1 in 263. And the risk of dying from testicular cancer is 1 to 5,000. So it's not really common, but we mentioned that it's common in people between 20 to 35, but it's not one of the cancers that a lot of countries diagnose and report with the WHO.
All right. Now let's talk matters diagnosis, and it's important for all cancers, as you guys have already put it as a health specialist, that we get to discover ways that we can detect any symptoms that can lead us to discovering whether we have a certain cancer or even any other disease. When it comes to testicular cancer, how do we detect if the cancerous cells are in the body?
Yep, let me say around 5 ways of detecting. One, you do what you call the ultrasound, and that will help you in terms of the images, being able to see if there are cancers that are dividing abnormally, which are the cancerous ones or the malignant cells. Apart from ultrasound, you can also do what we call biopsy. Biopsy, is the entire removal of the testicle, and be able to examine. But it's not about just removing the testicles. You also try to get a sample from the tissue of the testicles, and now that is what you are going to evaluate and see if there are cancers that are dividing abnormally, or cells that are dividing abnormally.
Allow me to interrupt you. Are you removing it to take it back to the body?
Yeah, it's taken back.
Okay.
Yeah, it's removed and through the groin, and that is taken back to the body.
All right.
Yeah.
Okay.
Yeah. So after doing that, there's also what we call a CT scan, or what we call the computerized tomography. That helps you also to the images of the pictures, and be able to just view if there are cells that are dividing abnormally. This is similar to what is done also in cervical cancer, where it involves observation and be able to see the images, and you will be able to detect and also diagnose. Of course, the part of diagnosis only comes when you do biopsy. Other ways of detecting cancer, what do we call it? Testicular cancer, which is physical or self-examination, are not a confirmation test for cancer, for testicular cancer, until you do the biopsy.
All right.
Is when you confirm this, that you have cancer or testicular cancer or not. But also there is what we call Serum tumor Mucus test. You can also do that. This involves the tumor Mucus. There's tumor Mucus for testicular cancer, which you would be able to, when you notice such tumor Mucus. Of course, there are a lot of medical jargons which I don't want to bore our viewers with on which markers are these, but there are markers which, if you see then really that tells you it's cancer or it's testicular cancer. Yeah, so CT scan, X-ray, ultrasound, physical examination, or family history. For example, if you in your family there are people who have testicular cancer, then that also would work as a way of detecting.
All right. Okay. As you continue to talk about self-care and how people can take care of themselves, lifestyle is of importance, and many cancers, other cancers and many other diseases away from the cancers have been termed as lifestyle diseases. And so that means our lifestyle really goes to contribute to how we will, how our health system and our body systems will be health-wise. So do we have activities that men specifically do, because this is a cancer that really affects the male gender? Is there activities that men do, and especially these young men, that can increase the chances of one contracting testicular cancer? And if these activities are there, what can we do to avert them, to stop this cancer from affecting more people?
Okay, now talk about lifestyle. Of course, if we look at all, maybe let me talk about all NCDs. Of course, lifestyle is a very, very big contributor to all these chronic diseases. One of the things that is so particular with testicular cancer is also in terms of our dieting. What do we really eat? That is, if we are eating food that is laden with what do we call it, calories, then it means also you're going to have testicular cancer, and also because of things to do with high blood sugar and all this, so that will lead to testicular cancer. So in terms of how do we eat, are we only eating food that is laden with calorie dense food? And also in terms of lifestyle, you can look at those who are, I call them party hoppers. People who, every weekend you find them, or every other day they are from one party to the other, and these parties are, marked or characterized by heavy drinking, alcohol, smoking, all this kind of, talk about shisha or what have you. The list is too long. And that can also lead to testicular cancer, because we know drugs also are a risk factor to all these cancers, that will link to it. I would also mention in terms of lifestyle, those who are living sedentary lifestyle, where the people just sit and relax, they don't do anything, they don't exercise. And that will mean that you're not really watching your weight, and that, being obese is also a risk factor to testicular cancer. And all other type of cancers and all other chronic diseases. So your sedentary lifestyle, drug abuse, so that is particular to alcohol and smoking, and also what you eat and lack of physical exercise.
All right.
That is a lifestyle. I can connect it with testicular cancer.
All right. Now, as we wind up, in the next 2 minutes, as we wind up, there's an issue I want to bring on board. As I did my research, I discovered that many health experts are saying that this cancer is highly curable compared to other cancers. How true is this from your research? And what do you have to say about this as we wind up?
Yeah, well, I don't know whether you ask how true is my research, is me doing a research, but of course, I've not really conducted research on this to see what I've found or I bumped into. Mention that testicular cancer, there's what we call the stem cells, and testicular cancer stem cells, their stem cells are responsive to chemotherapy, because we know that chemotherapy is the type of treatment for, we apply using chemicals and all these things to treat chronic diseases, particularly cancer. And so the stem cells of testicular cancer are responsive to chemotherapy, as compared to other type of cancers. And that's why there's highest percentage of you recovering from testicular cancer and not other type of cancers. One thing you have to note is that for early detection, if it's detected early, there's 98% chances of one being able to recover successfully and be able to live without testicular cancer.
All right.
So that is really the reason. Of course, this is an active area of research because it's not so common cancer, but it's an active area of research to really try to illuminate on this and ensure that we know more about why is it really curable. But one thing that I have to mention is that their stem cells are responsive to chemotherapy. Yeah.
All right, thank you so much, Oduor. Just before I let you go in 1 minute, you recently won an award in the Quality Healthcare Kenyan Awards. Tell us about this. What did you do? And what will you continue to do to make sure your good name is out there and you're helping people become better?
Yeah, I'm really, really proud about this award. Of course, I need to tell our dear viewers that this is the Quality Healthcare Kenyan Award, which was, it's a brainchild of a lady called Grace Ndegwa, and also working with AMREF and other partners. So we participated in the Quality Healthcare Kenyan Award twice, and even last year during COVID-19, we also won this category. This is a student innovation category, the student innovation project of the year category. Of course, these are projects we started while we were in KU. That's why we're still using the name of KU to participate in these awards. And I think it's also something that KU should also be grateful for, because their name is flying high, courtesy of my organization, Link, and courtesy of the individuals who are here at School of Public Health. So we participated in this project using the NCD 365 project, where we were trying to bridge the information gap on NCDs. And also things to do with testicular cancer is something that we highlighted last year during this month. And we were feted during this award, and this award serves to amplify what we are doing, and it has exposed us to global platforms and has given the opportunity to be able to showcase what we're doing as individuals and also as organization. My organization, which is Link, where I serve as the Chief Programs Officer.
Amazing. Yeah. Thank you so much, Oduor, for coming tonight. For the sake of time, that's why we stop it for today. But we shall be back to talk about other diseases, other cancers, other health programs that people can benefit from.
Yeah, thank you for inviting me too.
All right.
Yeah, I love it.
All right. Kevin Oduor, health specialist, talking to us about testicular cancer. We come to the end of our discussion for tonight. We'll be having more conversations on health, environment, entertainment,